How did it happen that, according to the CDC, the rate of childhood obesity in America has tripled since the 1970s and has gotten so bad that 1 out of every 5 children in our country is now obese? How has it happened that over 40% of adults in the United States today are obese? And in my view, the answers to these questions are not very complicated. For decades, Congress and the FDA have allowed large corporations to make huge profits by enticing children and adults to consume ultra-processed food and beverages loaded up with sugar, salt, and saturated fat. There is growing evidence, including testimony that we have heard right here in this committee, that these foods are deliberately designed to be addictive, similar to cigarettes and alcohol, and lead to a higher rate of type 2 diabetes. Shockingly, according to a study published in the British Medical Journal, ultra-processed foods make up an incredible 73% of our nation's food supply. Bottom line, much of the food that we as Americans are now consuming are making us unhealthy and are contributing to the fact that our life expectancy is significantly lower than that of many other wealthy countries. None of this is happening by accident. The food and beverage industry is spending $14 billion a year on advertising to push these unhealthy products onto the American consumer. Even worse, and really unacceptable, $2 billion of this money is spent to directly advertise these unhealthy products to our children in order to get them hooked on these foods at an early age. According to the Rudd Center for Food Policy and Obesity, children and teens view about 4,000 food and beverage ads on television each year, an average of 10 advertisements per day. Last year, for example, Coca-Cola spent $327 million on advertising in the United States alone, while it raked in more than $9.5 billion in profits. Not one of these ads will tell you that a 20-ounce bottle of Coke contains more than 15 teaspoons of sugar. 15 teaspoons of sugar, over twice the recommended daily limit for kids. Not one of these ads will tell you that drinking 1 can of Coke a day could increase your chance of getting type 2 diabetes by up to 26%. Given this reality, which has been widely discussed by scientists and doctors for decades, this really is not new news. If there is a mantra that exists in this committee, I think on both sides of the aisle, is that an ounce of prevention is worth more than a pound of cure. And that is going to be what we'll be discussing today. In America, it is no secret to anybody that we have a major obesity epidemic as well as an epidemic in diabetes. They are both directly related, and they are both getting worse. More than 35 million Americans have type 2 diabetes, over 10% of our population, 10% of our population, and about 90% of those with type 2 diabetes are obese. Diabetes is not only a serious illness unto itself, but it is a contributing factor to heart disease, stroke, amputations, blindness, and kidney failure. And the cost of treating these illnesses is staggering. According to the American Diabetes Association, the total cost of diabetes in the United States was nearly $413 billion. $413 billion, up 27% over the past 6 years. This amounts to about 10% of our total health care expenditures. That is an unbelievable and unsustainable amount of money. And when we talk about the type 2 diabetes epidemic and the huge increase in new cases, we must also talk about the epidemic of obesity in our country. Some 90% of people with type 2 diabetes are overweight or obese. These two epidemics go hand in hand. The time is long overdue for us to pose some very simple questions.
America on top, but unfortunately that also includes the cost of healthcare. Here's my breakdown on why we spend almost double per person on healthcare while visiting the doctor less than similar countries. Also, if you haven't seen me before, I'm Eric the Engineer, and I try to research and explain topics in a way that everyone understands. To recap, insurance is essentially a pool of money that people pay into, so when accidents happen or you have higher medical costs, these are offset by others who didn't use the insurance as much. You got three main buckets: government, private, and uninsured. The government's unique because all or some of the insurance pay-in is covered by them on behalf of you. For private, employers often cover some of your pay-in, or you have to pay it yourself. But keep in mind, private is broken down into tons of companies like Kaiser, Blue Cross Blue Shield, Cigna, and so on. Now, if we objectively look at which insurance has the lowest cost rates for procedures, checkups, whatever, the ranking is government, private, and uninsured. And that ranking all stems from how much money is in their pool. The bigger the pool, the more bargaining power. The government has a lot of money and brings a lot of business, so hospitals really want to make sure they don't piss them off. Hence, their negotiated rates are much lower than a private, much smaller company. If you're uninsured, you essentially have no leverage, and hospitals can pretty much charge you whatever they want. So because of this, there is one huge issue. Every single insurance company has a different negotiated rate for every single procedure. And even worse is that the rate's constantly changing based on power dynamics and market conditions, which results in an ungodly amount of administrative costs. But you might ask, well, Eric, shouldn't the free market regulate based on competition? Well, in theory, yes, but since private health insurance companies and many hospitals are for profit, there is an incentive for the entire industry to make prices as untransparent as possible. If every insurance company made it easy for you to know how much you would pay out of pocket for a particular procedure or service, competition would drive prices down. But this also means less money for the insurance industry and less money for hospitals as insurance companies go bankrupt or merge due to price pressures, giving the new larger companies more negotiating power.
These are the top 5 destinations Americans travel to for affordable healthcare. Number 1, Thailand. It's a leader in plastic surgery and wellness treatments and receives 3 million medical tourists annually. Procedures in Thailand can cost up to 75% cheaper. Number 2, Turkey. Also called the hair transplant capital of the world, it welcomes around 1.4 million medical tourists annually. You can save over $10,000 on a typical hair transplant. Number 3, Mexico. It's known for dental procedures, weight loss surgeries, and cosmetic treatments. Over 1 million Americans visit annually, and it has clinics dedicated to American patients. Savings range from 35% to 50%. Number 4, Brazil. It's renowned for expertise in aesthetic surgery and is a pioneer in techniques like facelifts, liposuction, and body contouring. Number 5, India. It's a leader in advanced medical procedures like cardiac and orthopedic surgeries and offers savings of up to 80%.
あなたがアメリカにいて緊急で、救急車を呼ばないといけない場合、その救急車を手配したときはいくら支払わないといけないと思いますか
？5000円ぐらいですかね。
1000円以内じゃないときついかなと思いますよね。
2万とかじゃないかな。多く見積もって。
正解は1200ドル、日本円で17万6000円。
高いっすね。呼ぶだけですか？呼ぼう。マジっすか？
呼ぶので。
いや、なかなか呼べないです。車でもう直接行くみたいな形になっちゃいますよね。
日本だと救急車の要請はいくらぐらいかかりますか？
お金かからないです。
なんか俺前1回酒を飲みすぎて、で1回確か5000円くらいだったかなと思います。
その呼んだ人が払うお金っていうのは実は無料なんですね、日本では。
俺なんか払ったことあるけど、あれ何なんだろう。
治療とかをした場合は別にかかってくる。
呼ぶ分にはあれか、だからあれか、ちょっと前になんかタクシー代わりに使ったりするやつとか出てきたのか。
悪いやつないな。
Wonder if you could tell me how expensive you think calling an ambulance out to your location is in America.
I guess it depends on like where you live. It really does. Is there a price for that?
Yes.
Jeez, $100, $200.
$2,500.
For what? Why? Why?
Give birth by C-section, and you would like to hold your baby after you've given birth to it.
Actually, yeah, that's what you do. Yeah, you have to pay to do that.
Yes.
To hold my own child that I've been carrying inside of my womb.
Say something else.
Sorry, I was.
But yes.
Jeez.
It's not actually that expensive.
Right. Charging me. I'm gonna punch you.
Yeah.
Not you, but the doctor. Like $100.
$40
$40.
for skin-on-skin contact.
So we're in Valencia, Spain, and my wife got sick, and she'd been sick for like 10, 11 days. It's not getting any better. It's just really, really bad cold and flu symptoms. So finally I was like, let's figure out this Spanish healthcare and let's see if we can get you antibiotics or something. Within 20 minutes of deciding that we really need to get a doctor, she has her telemed appointment already scheduled and it started. The cost of this appointment is $29 with no insurance. We don't pay taxes. We don't have the benefit of free healthcare in Spain, like a tax-paying citizen would have. But $29 to see a doctor, effectively, or a telemed doctor. She talks to the doctor in English. Easy, super easy to understand. Explains what's going on. They ask her some questions. They say, okay, yeah, it sounds like you need antibiotics. They give her a prescription for antibiotics and something else. And the way they give us prescriptions is they send an email that has a couple of QR codes on it. And you take your phone to a pharmacy, which they're on every corner. There's pharmacies here. And all you do is you walk in, you show them the QR code, the email with the QR codes. They scan it, they turn around, and then they hand you the prescription. There's no name on it. You don't wait. There's no filling the prescription. None of that exists. Total cost for the antibiotics and another, like, medicine to make things run better, right, was $11. So our total cost, 2 hours from, hey, I think we should go to a doctor, medicine in hand, was $40. $40. And that's without insurance. We're paying $1,000 a month for insurance, and it would have cost us more than $40 just for our prescription. Not to mention whatever our part of the copay was for the doctor's appointment. Not to mention however long it would take us to get that appointment. Man, they're doing something right here in Spain, I tell you what.
Norway has free healthcare. That's what I said, and it has caused quite a stir, but you gotta let me explain. Of course, nothing is free, but what I mean is that it's included in our taxes, because in America, you have to pay crazy taxes plus healthcare. Look, here's an example. So in America, you're paying crazy taxes on everything. You're paying taxes on the money you make, taxes on the money you spend that's already been taxed because you made it. You got to pay taxes on taxes. I mean, even when you get your tax returns back, you still then have to pay a tax on the tax return. But you can see here, someone posted this on my other app, and it says that she pays, as a woman, she pays $600 American a month for insurance, and that's for her and her children. I don't know how many children she has, but her medication is not included in that. Medication is another $200 a month. Then anytime they have to see a doctor, it's $50 extra per person. And that's just for the general practitioner. That's just for your GP. If you need to see a specialist, it's another $135 per person. Then if you ever need an ambulance ride, it's between $500 and $2,000 extra dollars. And she only lives 2 miles away from the hospital. If she's admitted into the hospital, then she has to pay $500 for an emergency room fee, plus an additional $200 every day that you're in the hospital. And those are her costs after insurance is paid. So, I mean, look at that. She had a $30,000 insurance bill and all types of stuff. So when I say Norway has free healthcare, what I'm talking about is that it has already been paid. It's been paid with our taxes. We don't have to pay anything extra. You get what I'm saying now? Because just imagine if you were paying 30, 32, 34, 40% taxes, and then also had to pay for everything to do with healthcare. Yeah, it wouldn't be so nice.
American healthcare, pros and cons as a Brit living in California. So I often get comments from people saying, don't get sick if you're in America. Well, sadly, my husband did get sick. So within a couple of months of living in America, my husband had quite a serious seizure disorder diagnosed. We twice had to call an ambulance, twice go into the emergency rooms. And I would say a massive pro for us is the quality of care that we received. So we had an ambulance come to our house, collect my husband, take him to the emergency room. He had, all different types of like scans, testing, blood tests, and we had all the results and we're home within 3 hours. That is unheard of, in my opinion, in the UK. Absolutely unheard of. I feel like he would have been in the waiting room for hours and hours and hours. Downside to that is the cost. So at the time we had very, very good insurance. We actually only paid, I think, $300 of that because we had like I said, very, very good insurance. However, on our current insurance, if that was to happen, we would be looking that I think our out-of-pocket maximum is $8,500 and our deductible is $5,500. So we would have had to pay that before the insurance would have actually kicked in. I think just for one hospital visit, so one emergency room visit, I think was around about $50,000, and the second I think was 45, something like that. So the cost to me is a massive downfall, as is the complication. Having moved here, I mean, maybe if you grow up with American healthcare, you just grow up with these sayings and it's not confusing to you. But having come from England, having to learn what out-of-pocket maximum is, what a deductible is, what a copay is, how it all works, when I needed to see a neurologist here, one, I had to find the neurologist. In the UK, I would have just been given the neurologist for him to see. And the wait times were really, really long. So I think the wait to see the neurologist we actually wanted to see was a year. Obviously, I found a different neurologist and I managed to find a way in. I feel like where there's a will, there's a way. But yeah, I do feel like you kind of need to understand the American system. You need to understand the lingo. You need to understand the different medical professions. I mean, thank God for Google, but also the cost. I am aware that people sometimes do go bankrupt in the US because of medical issues, and I do personally find the healthcare here very, very expensive, but we have had brilliant care.
Like as good a time as any to explain to you exactly why insurance companies are the problem. Okay, they are the problem. And listen, I'm a medical billing specialist. I find that most people outside of the industry do not understand that this is happening. So just give me a second and let me explain to you their scheme, their scam that keeps healthcare in the United States so effing expensive. Insurance companies basically make doctors sign contracts that say, whatever you charge us, you have to charge your patients, whether they have insurance or not. So if you charge $100 for this service, you have to charge your patients $100. Technically, those cash prices that you're getting are not allowed beyond a time of service discount. So like 10-15% if you pay at the time that you get your service and they don't have to do the administrative work of billing the insurance company, you are allowed to give them a tiny discount. Now, here's what they do. Rather than make the cost of a service affordable, let's say the doctor's billing $100. Okay, so they say, I charge $100 for the service. The insurance company says, okay, we're gonna pay $75. Okay, but 75 is still a really elevated price, right? Why do they pay 75? Why don't they pay 35? Why doesn't that cost 35 like the rest of the world? Because it keeps the cost high. And then what do? Is they turn around and they deny whatever they can. So rather than pay $35 for 4 or 5 people to get that service, they're going to pay $75 for one person, and then they're going to deny the rest. And if you had a system where the doctor said, okay, well, $35 is a reasonable price, so let me charge my cash patients $35, you are going to get kicked out of that insurance network because you are not allowed to do that. You have to charge whatever you charge the insurance company. Well, why can't I just charge the insurance company $35, and if their allowed amount is $75, they'll pay $75? They will not. If you don't bill an amount that is higher than what they're paying, they'll pay what you billed. So if you pay $100 and their allowed amount is $75, they'll pay you $75. If you bill $35 and their allowed amount is $75, they're going to pay you $35. The whole thing is, it's a scam. It's a scheme that intentionally elevates prices out of the range of affordability and then swoops in with insurance plans as the solution for the prices that they artificially elevated.
RN that spent the last 3 years working in America as a travel nurse, and let me tell you the top differences that I noticed between the Canadian healthcare system versus the American healthcare system. First, let's talk funding. In Canada, our healthcare system is publicly funded, so our tax money goes towards the cost of healthcare, meaning that most Canadians can go access the doctor without having to worry about the bills and the cost of that. In contrast, in America, the healthcare system is privatized, meaning most people are completely reliant on employer-based insurance services to access healthcare. And if they don't have insurance through their employer, then they have to go purchase insurance on their own. And usually that comes with a high cost, lots of co-pays. So unfortunately, a lot of people just don't go to the doctor. Not only that, the insurance companies will always try to find a loophole to not have to pay for that procedure or surgery. Next, let's talk wait times. So because we have a public system in Canada, most people have to wait a little bit longer to receive their surgeries or even in the ER. And in America, because it's privately funded, you can just pay the money and see a specialist much faster. You actually don't even need to get like a referral from a family doctor. You can go and see any specialist you want right on your own. Next, let's talk health outcomes. So even though we're not perfect, far from it, we tend to have better health outcomes than in America, and that's because of the universal healthcare. Canada has a higher life expectancy versus America, even though it's not that much different because of the access to healthcare that we have. Even though the United States has access to the best technology, the most cutting-edge innovative treatments, we still see a lower life expectancy. This reminds me of a story from a few months ago. I had a patient who was having surgery to remove a few of his toes because of his diabetic gangrene. And when I was talking to him about diabetes prevention and managing it and such, he looked at me and said, "I don't have diabetes." And I said, "Sir, not only do you have diabetes, you have a late stage complication of diabetes." But because he has not seen a doctor in the last 20 years, never had blood work in many years because he couldn't afford to see a doctor, he ended up having to have his toes amputated, which was completely 100% reversible if it was caught early. So stories like that make me realize that prevention is so key, and even more so for us in America and Canada, because we have to take our health in our own hands because we can't rely on this system to take care of us.
640 pesos. That's about $11. So I'm back in the Dominican Republic with my wife visiting family. See? Out in these Dominican streets. The last year we was here, my daughter had to see a doctor for a real bad ear infection. And the total price ended up being like $15, $18. And that was a collective of being seen and getting medication. Come back this year, and amazingly, my wife has to get seen also. Now, for an exam and x-rays, it only costs 640 pesos. Got medication, another 200 pesos. So $4 or $5 more. That was the total amount for the clinic visit. Now, my wife works in the ER, so I know she knows how much these things cost. She knows the markup. She lets me know it's a 300% markup. She points out how they don't wastefully use items that aren't needed and how they make do what they have. So I have to ask, I gotta ask, why is healthcare in the United States so expensive?
I just went to the doctor in Spain for the first time, and I have a quick little rant about the U.S. healthcare system. So here in Spain, I have private insurance. I don't qualify for the public insurance because I don't pay into it, and I'm not a citizen. So I have private insurance through Cigna, which we obviously also have in the U.S., and I've had Cigna in the U.S. before. So my company pays for it, but the point of this video is, even if I were to pay for it by myself, which I'm sure a lot of people do, the plan I have, which is a good one, is about $50 a month. And on this $50 a month plan, there are no deductibles, no co-pays, and no maximums. So I just went to the doctor, and it was the most seamless experience. You just walk in, give them your number, they see you, and I'm not going to get a bill in 7 months for $250 that I didn't know I was going to get. And the plan I have is on the more expensive end. You can get plans here for like $15 a month. And the healthcare here is good. They have great healthcare, great doctors. And I'm a little bit like flabbergasted. I don't know quite the emotion yet, but back in the US, I did Cobra a couple times when I quit my jobs, and I was paying upwards of $800 a month. $800 a month. And when I was younger and traveling, I was also paying for insurance for myself. And I'm pretty sure I was paying about $500 a month. And this is for something that probably never would use, but have to use it because if I did have something happen to me and I had to go to the hospital, it would be $1 million without insurance in the US. But here, honestly, I could just, God forbid, get hit by a bus and crack my head open, go to the hospital either for a month and just like pay nothing. Just this peace of mind that it creates actually is a little bit shocking to me because I just feel so free. Like I feel like I can go to any doctor I want and it's totally chill. No surprise bills, no deductibles, no having to pay up to $2,500, $5,000, whatever, until insurance covers everything. It's just wild. And it's kind of disappointing because I don't necessarily want to live in Spain or Europe forever. I would like to move back to the US at some point, but it's kind of like, how do you come back from this? How can I come back for having amazing healthcare that costs about $50 a month to the US and paying more than $800 a month for something? It's just unbelievable. And it kind of makes me pissed because, as I mentioned, it's Cigna. It's Cigna in Spain. It's Cigna in the US that I had. And it's like, how can the same company charge $50 in Spain or less and more than $800 in the US? And the $50 plan is better. It just makes me kind of sick, actually, that like insurance companies do that just because of the way our healthcare system works. So anyway, that's some food for thought. That's what I'm kind of relishing on my post-doctor walk.